Here's a general outline of how to perform a neurological assessment. Preparation. Gather necessary equipment such as a pen light. Introduce yourself to the patient and explain the purpose of the assessment. Ensure patient confidentiality and obtain consent. Observation. Observe the patient's general appearance, behavior, and level of consciousness. Note any signs of distress, agitation, or lethargy. Mental status examination. Assess orientation to person, place, time, and situation. For certain patients, you may need to evaluate short-term and long-term memory. Assess attention, concentration, mood, and affect. Evaluate language skills such as comprehension and expression. PERLA, pupils equal, round, reactive to light, and accommodation. Inspect the pupils for size, shape, and symmetry. Normal pupils are typically round and equal in size bilaterally. Dim the lights in the room. Shine a penlight into one eye at a time and observe the response of the pupil as well as the consensual response of the non-illuminated pupil. The normal response is constriction of the pupil when light is directed into the eye and simultaneous constriction of the opposite pupil, consensual response. Repeat the process for the other eye. Assess accommodation by asking the patient to focus on a distant object and then quickly shift their gaze to a near object, e.g., your finger held about 6 inches away from their nose. Observe for pupillary constriction, convergence, when focusing on the near object. Cranial nerve assessment, 7 and 12. Ask the patient to smile, show their teeth, raise eyebrows, puff out cheeks, and close eyes tightly. Assess for any asymmetry or drooping on one side of the face. Ask the patient to stick out their tongue and move side to side. Assess the strength of tongue movement. Assess speech for any slurring or difficulty articulating sounds. Motor and sensory. Assess muscle strength bilaterally in upper and lower extremities. To assess grip strength, have the patient squeeze 2 fingers. Assess arm strength by having the patient push and pull their arms against resistance. Perform dorsiflexion and plantar flexion. Assess for pain, weakness, limitations in range of motion, and differences on either side. Note any tremors or abnormal movement. Using light to moderate touch, test sensation bilaterally on upper and lower extremities. Assess for any numbness or tingling. For some patients, you may need to assess deep tendon reflexes bilaterally. Assess the patient's gait and coordination. Observe for any abnormalities such as weakness, ataxia, or imbalance. It's important to tailor the assessment to the patient's condition and clinical setting. Repeat assessments as needed based on the patient's condition and clinical judgment. Monitor the patient for any changes in neurological status. Document findings accurately and objectively. Communicate abnormal findings to the healthcare team.